Could I have adopt the agenda?
Camp, so move.
Beaver, second.
Motion has been made and supported to adopt the agenda. All in favor signify by the sign of aye.
Aye.
Aye. Opposed? The ayes have it, so order. Next is approval of the minutes from January 13th and January 28th. Could I have a motion?
So moved by Beaver.
Camp, second.
Motion has been made and supported to approve minutes. All those in favor signify by the sign of aye.
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 Opposed? The ayes have it, so ordered. Item 4 is introductions. Do you have the names of the other people who are in the meeting for the minutes? Michelle?
I'm sorry, I was still on mute. I just need to know who is number 9277549. Would you like to identify yourself? That is the only number I don't know. I don't think they want to identify themselves, Supervisor Brian. Oh, they left.
We did get 4 letters or communications yesterday, and we did forward them on to the members of the committee, and they will also be part of the record. Are there any other communications or announcements?
Did you want me to read the letters or no?
No, that's okay, because they'll be part of the minutes, and all the members did get them.
Okay.
Item 5, review of the payments.
So Joanne Boss is actually not in today. She became a grandma yesterday, so she's got a little time off to be with the baby. So I'll do my best to go through the review of payments for you. Are there any questions that you guys have on those committee review reports from December of 2020?
No.
Supervisor Beaver, Supervisor Brian, any questions on Joanne's reports for the December?
No.
Here. Okay, item 6 then would be budget transfers. Do we have any budget transfers today?
No,
My
we
knowledge,
don't.
no.
Did you say that there are none, Michelle?
No, there's none.
Okay, item 7 then, the finances. Joanne?
So Joanne did share with me to review with you the CARES funding for the COVID related expenses. And we did receive 3 payments. One of them was on January 25th of 2021 in the amount of $129,254.63. And that was for the infection prevention incentive payment in November. The third one we received on January 26th of 2021 in the amount of $11,600. And that was for nursing home admission incentive payment. And the third one was received on February 1st of 2021 in the amount of $197.80. And that was the second round of CARES payment extra funds. Any questions on that?
I don't hear any questions.
Nope.
We'll go on to
Nope.
item 8, and the nursing home administrator report.
So I'd like to point out at the bottom of the report our star rating for Rockhaven. And I'm pleased to share with everybody that our overall star rating has went up from a 2-star overall to a 3-star overall. There's a couple factors in that. On top of the hard work and dedication, it's the focused infection control surveys that we had 3 of them during the COVID period. That was a huge impact. And also being that we were deficiency free for all 3 of those surveys, that really speaks volumes to what we're doing here with the programs and the safety. Also, we had opened up a QAPI, a quality assurance improvement process for the use of Foley catheters that were indwelling in the bladder. And we identified per guidelines that there are only 2 acceptable diagnoses that we can have for those. And so we did a complete review of everybody in house and contacted doctors and worked on getting either an appropriate diagnosis, or if there was not an appropriate diagnosis, we did trials of removing those Foley catheters and monitoring residents, how they tolerated it. So overall, what that means is we were able to remove unnecessary catheters from residents, which would improve their quality of life. So that was also a big factor in our overall star rating improving. So very proud of the team for that. Were there any questions on anything else listed on that administrator's report?
Nice job to hear that you guys went up to a 3-star. Congratulations.
Thank you. It takes a team.
It does. Morning, Kathy.
Good morning. Can someone tell me where we are on the agenda?
Number
We
8.
just finished up the administrator report.
Okay. What number is that?
8.
Okay, thank you.
Kathy, are you there?
I am. Can you hear me?
Can now.
All right. Very good.
Said that you had some, you sent me that email about concerns about COVID and patients.
Correct. Yes. Is that something we can talk about now or what?
Yes, ma'am. That's what I'm waiting for.
Okay. Yes. Sarah, I'll direct the questions to you. Of the 5 residents who have not taken the COVID shot, what precautions are we taking with them to ensure that they're staying safe and away from anybody that could be a possible carrier?
Yep, so the number actually went down to 4. We did have 1 POA change their mind and want the resident to have the COVID vaccine. And then the other resident who was unable to get it at the first round had completed the antibiotic course, so was able to receive it as well. As far as keeping them protected, we are aware and made staff aware per the care plans. They've been updated, identified in their individual person-centered care plan that they had, chosen not to get that vaccine. So we have the heightened awareness that we continue with the PPE for them. We don't want to take away any of their abilities in their home to participate, but it's making us aware to monitor them the 3 times a shift.
One of the things that occurred to me is we have quite a few of the staff that have taken it. Is it possible for the people that have not taken, the residents that have not taken the shot, that we could just put staff in their rooms servicing them? Only the staff that has actually had the shot. So we can offer at least that protection. And if they're, I don't know, have they been ever offered a mask, or if their doctor would permit that?
Yeah, so part of our COVID-19 program in the CMS guidance actually requires that we have to offer every resident a mask. So we implemented a program where our front desk lady was kind enough to help us with accommodating a mask for each resident, bagged with their room number on it, and those get passed out. We encourage the residents to wear the mask. However, we have some people who just cannot tolerate it, or some people who just don't cognitively understand the use of the mask. We could put it on, but they might take it off. So we continue to encourage and educate risk and benefits of that as well. So I do think that the staff are doing a wonderful job with that. I know that we don't always use all the masks, and that's because a lot of the residents do not come out of their room. They understand the precautions, not that we're telling them they can't. We would encourage them to stay in the room to stay safe. And as far as the staffing goes, that would be something that would be extremely cumbersome, and I don't really think realistic to consistently be able to provide certain staff with the vaccine to those residents without.
Okay, but how many staff have utilized the exceptions? Either they have a medical reason, or they have a religious reason, or the other status. What I'm thinking is, it must be a fairly small amount. If at least you could see that those staff that have not had the shot are working with residents that at least have had it. I mean, it seems like a small little thing to do to ensure their safety. And I think we should use every option possible. So that's, why I'm bringing this up.
A lot of staff, and I could look up the number. I believe I have sent it in a report to you guys at least once, if not a couple of times. I could look up the number again if you'd like me to, and send that to you later. But there are quite a few staff that are not direct caregivers that have received accommodations as well. And it's something we can look at, but I mean, routinely around the clock, being a 24/7 place that functions, it would not be consistently what you're requesting. I mean, we could attempt, but there just wouldn't be the consistent around the clock.
Well, I would appreciate it if you take a look at trying to implement that, because, I mean, there's more than one way we can help keep people safer. And that's all I'm saying is, let's try everything within our reach.
It's something, yeah, I can definitely sit down with our scheduler and we can try to see what we can accommodate with that.
Okay.
Thanks, Kathy.
Thank you.
Okay, item 10B would be the medical director. Is there any more of an update on that?
No, so the status of the medical director still remains as it's noted in our meeting minutes from the last time, that Dr. Shea continues to be the interim medical director until the new NHA is hired and on board to decide what direction she would like to go moving forward.
Okay, thank you. I'll item 11A. This is an action item. Confirmation of appointment of the nursing home administrator. Could we have a motion for that?
So moved by Beaver.
Second by Schultz.
The motion has been made and supported for confirmation of the new nursing home administrator. Josh, do you want to take that?
Thank you, Chair Brian. I think everyone's aware of Natalie's agreement to come on as our next nursing home administrator. So I don't need to go any detail about her background. I think that should have had access to the email that I sent, as well as the county board. So she's planning on starting on the 22nd of March. I appreciate this being on the agenda today so that we can have it approved at the county board meeting tomorrow. I did talk to her yesterday, and she will be in attendance at the county board meeting just to briefly introduce herself after that resolution is hopefully approved by the full board. But I don't know that there's a whole lot more to say about that at this point, unless anybody has any questions.
Do any members have any questions, Josh? Okay, hearing none. All those in favor of the motion signify by the sign of aye.
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 Opposed? The ayes have it, so order. The next item then would be item B, information item on nurse practitioner hiring process. I assume that is still kind of on hold till we get the new administrator on board.
That's correct, Supervisor Barry.
I would like to add, I am concerned about how is that service being met for the residents. It's been quite a while since January. Angie is gone. So who's taking care of that?
So as Dr. Shake had alluded earlier in one of the previous meetings, it is him and his team of residents, his faculty team that oversee the residents in his clinic that have absorbed that role.
I don't know how he could do all that with 5 or 6 hours when somebody else was spending a lot of hours doing that. You know, I just think the delay, I don't know, if anything, maybe one could talk to Natalie and get an idea of, you know, how we could move this along a little faster.
Maybe I could jump in here. So as far as discussions with Natalie goes, you know, I told you to have a discussion with her. She asked some questions about kind of, you know, she's trying to prepare. So in the same spirit of your conversation, Supervisor Schultz, you know, that being said, you know, I think she'll be primed for some of the decisions she has to make upon her arrival, one of which is about the medical director and nurse practitioner. I think the challenge that we face, and I think the committee would agree with this. I think that we do want Natalie to make that decision, you know, as sort of the long-term, it's a pretty significant and long-term decision for the facility. I don't think we want that being made beforehand and potentially then having more of a dynamic of disagreement over that approach and who's in that role and how that works. So I know there's still another 6 weeks away before Natalie, or 5 weeks away before she's able to show up, and there'll be some time for her to make that decision. But all that being said, I think that truly that is something we do want our new administrator to make a decision on, to make sure it's the right decision.
Okay. When Angie was hired, who did make that decision? When the former nurse practitioner was hired, who made that decision?
Right, that would have been made by the nursing home administrator.
So who was that?
I believe when Angie first came on, that Clayton was the nursing home administrator.
Okay.
I believe it was actually Sue Prosco, Josh.
Was it Sue? Okay.
Yeah, because I think shortly after she came, Dr. West exited, and that was with Sue Prosco still.
Okay. Thanks, Michelle.
I am concerned because of the amount of turnover we've had in nursing administrators waiting for one person when, I mean, I think the bigger picture is they need that service. The board felt that position was important. And whether, you know, I hope Natalie stays for a long time and she is with us. But what if she isn't? And then we're basing somebody else's job solely on the administrator. And that concerns me.
A lot of things that coulda, shoulda, woulda, but we don't know that. So I think we've got the process that we're going to be following, and wait until the new administrator's on board and then let her make the decision.
Okay, I just think that our residents are doing without.
Tom, I know this isn't on the agenda, but I agree that the nursing home administrator should be making this decision. We're not here to micromanage them. When Clayton was here, I went and talked to him on his last day of work, and I says, what can we do to make this job better? And he says, stop micromanaging. He says, it's my license on the line, not yours. We have to let them do their job. We cannot have someone keep coming to us with a problem. They need to follow a chain of command. They need to follow everything. And when they do all that, then they can come to us. Until then, we shouldn't be hearing about this stuff. It's their job. That's what we hired them for. Josh put Sarah in that position, knowing she could handle that position as an intern. Let them do their job. That's what I have to say about that.
Thanks, Ron. Item 12 would be reports, the census.
So our census as of today is at 90. We are working on referrals. We've got many that have come across the desk yesterday and today. So we will be working on trying to fill some more of those beds on our yellow unit.
What happened? Did some people die, or are they in the hospital, or what?
We had one person expire and we had another person go home, and then we're in the works of another person being discharged home as well.
Okay.
Thanks, Sarah. Do any other members have any questions? Okay, item 13 would be committee requests.
Hey, Tom, can we back up? I guess I missed the COVID-19 update. I had some questions that because of the letters we got versus what the numbers Shara shared with us. I think that the letters we got, the numbers were exaggerated maybe a little bit. They said that there was 50 shifts missed the day after COVID vaccines. According to what Sarah sent as an update, that's not correct.
Yeah, so the information that I sent you was a review of all the call-offs, and it was over a span of, I want to say it was 2 or 3 days total following that vaccine. So there were call-offs that were the same staff for a few days in a row. And then that was also an accumulation of every department. So then I broke it down for you in that email with the information of how many of those calls were from each department and how that was impacted. And I believe I actually broke down in that email as well the patient staff ratio.
Okay, so if I read it right, there was 32 people off the day after the vaccines versus the 50 that was in the letter. Is that correct? Or?
Yeah, I don't have that right in front of me, but if that's what it is stating, then yes, I'd have to pull that back up.
Okay.
Sarah, I have another question. How many staff?
Hang on here a minute.
Okay.
Ron's still got the floor.
Okay, sure.
You still looking for the email then, Sarah?
Yeah, I'm still looking trying to see which one it was.
It was the one you just sent this morning was from you, and then there was the letters that we got from Michelle yesterday, I believe.
Okay. That one from last night. Just give me a second. There's lots and lots of emails that get blown out of here. Here it is. Okay. So yeah, that letter or email that I sent you was response to those letters, clarifying information. What exactly you're looking for the call-offs under? Okay, so from 2/2 of 21 to 2/3, there were 32 total call-offs in the time period, 26 related to the vaccine. 16 of those were from nursing staff, which include the RNs, LPNs, and CNAs. With nurses, RNs, and LPNs, there were 5. One of these nurses called off for an AM shift, but was better in later hours of the day and came in and covered and worked a PM shift. CNAs, there were 10, and then there was 1 unit clerk. There were 4 dietary vaccine-related call-offs, 4 environmental service-related call-offs, and 2 administration-related call-offs. Other reasons for call-offs that were non-vaccine related, there's 1 environmental service worker with back pain, 1 environmental service worker for vomiting called off prior to the vaccine clinic, 1 LPN for exposure, 1 CNA used FMLA, 1 CNA called off on 2/2 prior to the vaccine due to gallbladder issues and in the ER, and then called up again on 2/3 for the same reason. And when you get into 2/4, on all shifts, there were 23 total call-offs in this time period. 22 were related to the vaccine. There was a total of 13 for nursing staff, including the RNs, LPNs, and CNAs. The RNs and LPNs made up 6, and then 1 nurse called off for 2/5 the following day. There were 5 CNAs plus the 1 unit clerk that day. Nobody from dietary, 7 from environmental services, 1 from materials, 1 from administration, and 1 CNA for FMLA. So all the shifts were covered, and the hardest hit overall department was actually the environmental services.
There wasn't 50 from the vaccine, it was 26 from the vaccine then, correct?
Correct, from that 2/2 to 2/3, yes.
Big difference, big difference. If there was 50 shifts, there's 24 that were called in anyway. Second question I have for you is, the state kind of regulates how you handle stuff when you have COVID, correct?
Absolutely.
So does it matter if it's a resident or a worker that has the COVID? Does that change anything? I mean, if you're reporting so many cases a week.
Yes, it does. It does matter. Makes a big difference. So when we report staff positives, we are not going to necessarily be guaranteed to see state come in the door. And mind you, they are working their tails off throughout the states as well. And they're prioritizing the highest risk population as far as which facility is worse off. When we have to report a positive resident, that is a red flag indicator for DQA, and they will be coming and looking. I expected them last week. They have not come yet. I did talk with our RFOD yesterday, Julie Brandt, and gave her a heads up on what's going on and where we're at. And she just offered, support if we need it, to let her know. And she said she's very pleased to hear how things are still running, considering all aspects.
Okay. And then, I kind of brought this up at the last meeting, that they've kind of brought it on themselves. And, it's disappointing when I look at the Janesville community page, there's a GoFundMe page, and there's a couple of people getting their picture taken, no social distancing and no mask. These are the employees that are spreading COVID. They're refusing to get the COVID shot, and they're not even wearing a mask, and they're smiling and taking their picture. I have a severe problem with this, and I'm still going to support this mandate. So it's what's needed out there. So Sarah, thanks for all your efforts out there making this all work. keep us informed like you are with the numbers so we know for sure what's going on out there. There's been stuff that's been sent to me that's complete false lies, and if somebody doesn't dig into the truth, they're only getting one narrative. I look at both sides, but I still think you're doing what's best for the patients, and thank you. I'm done, Tom.
Thanks, Ron. Kathy?
Yeah, I was just wondering, have you been able to use staffing services to make up for the shortages?
Yes, we have. We are actually, they're coming in pretty fast. I'm working with my scheduler and with multiple different agencies, and they're able to provide us with CNAs. And we're actually in the process of trying to recruit for a nurse supervisor who plans on retiring at the end of the month as well.
Okay, so like how many how many people from the staffing service have you been able to bring in?
We have currently, I want to say off the top of my head, there's at least 3 full-time CNAs that have covered shifts for us between AMs and night shifts. That was the request from our scheduler, but there are multiple others. I'd have to sit and go through them today. To be honest, I really can't keep up with it. My scheduler and I both really can't keep up with how many we have coming through.
Okay, thank you.
Mr. Chair, I have a question.
Go ahead, Mary.
So Sarah, you're hiring a new RN supervisor, right? Correct? So, and I'm assuming that all the people we're bringing in, and in future, any people that we were to hire all need to have the COVID shot prior, or are you going to offer it to them if they, don't have it?
So both. If they have it prior from a previous employer or a previous entity, that is wonderful. We ask for a copy of that card. And then if they don't have it and they happen to be able to come in by the 2nd of March, their last clinic with Walgreens, we would add them to after that date. We are able to set up something with the Walgreens, and or once we get everything finalized with CDC, we are setting up being a vaccinated to be able to give to our new residents that come in as well.
Cool. Thank you.
Okay. Seeing no more questions, our next meeting date will be Wednesday, March 10th. That will be via Zoom. And could I have a motion to adjourn?
Beaver moved. Oh, Beaver second.
Motion has been made and supported to adjourn. Is there any discussion? All those in favor signify by the sign of aye.
Aye.
Opposed? The ayes have it, so